Hey, warm greetings. Today, let us look at threadbare at some of the myths that we encounter regarding back pain. Whether it is rare, whether all back pains are spine or nerve related, is it bone related, does we require bed rest, many need surgery, what is the role of massage, local injection, is surgery is dangerous because it has nerves. Let us look through each one. In fact, back pain is the second most common after respiratory problems for which we seek help. It affects 70 to 85% of the population at some point of life, but only a small percentage requires surgery. But low back pain has a major economic impact in terms of people often take rest from work and it affects productive hours. But 90% resolve spontaneously within 2 weeks to 1 month. About 85% of the patients, in fact, no pathological diagnosis can be given. All back pain are nerve related or spine related? No. Back consists even muscle pain, spondylosis, disc problem, bone problem, infection, TB, all can cause back pain. In fact, muscle pain, sometimes even skin, just below the skin, what we call as subcutaneous fat, etc., the pain in the midline, often people perceive it as back pain. And very commonly, the muscular pain is often referred to by people as back pain. The spinal problem or back pain, what we commonly see, is the price which we humans have paid for evolution. That is, from four-legged animal, we have become two-legged, and now we have become hunchback animals. And because of this, the spine-related problems are more in us. As you see in this diagram, the nerve from the spine supplies almost all structures, including the muscles and up to the skin. Hence, any pain from these areas are often referred to as back pain or nerve pain. What are the common causes of this back pain? In young adults, spine-related back pain are usually because of disc problems like disc prolapse, etc., because they'll be doing often heavy work, sports activity, etc. Or it can be muscular pain like muscular sprain, etc., and other soft tissues strain. He may have climbed something or he may have hit against something. And sometimes infection, especially in India, tuberculosis is very common. In older adults, it is often degenerative, age-related problems, fracture because they tend to fall frequently, and another entity called as pathological fracture. That means there will be some underlying problem which has caused bone weakness, because of which even a minor trauma or in fact no trauma can cause fractures. It can be like osteoporosis, what is called as weakness of the bones, infection, cancer, etc. So we have to always know the what is the important treatment. Most important is education. That is, we should learn what is the probable cause of pain, and we should learn to relax that not everything is pathological or needs, surgery. But we should seek medical help as soon as possible. We should know the probable cause of pain and discuss it how to reduce the risk factors regarding, like if your position, if your workplace, or if you're driving two-wheelers too much, all these, whether it should be stopped, exercises, all these things we need to learn. And more than often, into one intervention may be necessary. Just giving some medicine is not always cure. Along with medicine, patient may adjust his posture, then he may need to do exercises. Most of the back pain, you need to do proper exercises and need to follow. Just once you show the doctor, that is not enough. You may have to visit again and again to adjust medication, exercises, and lifestyle modification. One simple thing is position. If you maintain correct position, about 20 to 30% of the people's back pain will be gone. As you see this diagram, if you stand against the wall and you are able to touch your back of the head, back of this neck, and your buttocks and leg in one position and straight most of the time, that means your spine is good. What are the risks? Always, as I told, it is not, most of it do not have underlying. What are the dangers or red flags for which we need to seek help? One, most important thing is if the back pain does not resolve by 2 to 3 weeks, regardless of age, etc., you should seek medical help. Second, if the patient, along with back pain, you have a leg pain, radiating pain, etc., and you feel some part of your leg or is numb, then you need to seek medical help. Apart from that, as I mentioned before, elderly, more than 50 years, you should seek medical help for persistent back pain. Apart from that, if you have underlying cancer or you're using some medication which cause bone weakness, such as steroids, and your back pain does not improve in 2 to 3 weeks, you should seek medical help. And with rest and does not go off, then you should seek medical help. And when you have night pains, you should always seek help. All need surgery? No, as I told. Low back pain is common and usually responds to non-operative management. And we need to look for red flags, which I have told. Only few need surgery, but most need treatment of some form or other, like rest, exercises, lifestyle modification, workplace modification, etc. Is surgery safe? Nowadays, surgery is very safe because of better understanding of anatomy, very various facilities we have, and good anesthesia. This is a what we call a CM or intraoperative X-rays. Because of that, we can localize and operate without with least damage. And I feel microscope is one key instrument which has made a lot of difference, because we can do what is called as minimally invasive surgery, and damage to nerves are almost nil in the present modern day surgery. These are some of the examples. This, as you see at one level, there is a extruded disc which we can operate through minimally invasive or microsurgery. And this is one place where you see the bone as dislocated, that we can often operate via what is called as spinal fixation surgery. And this is what is called as tuberculosis of the spine, which have operated. It may require little extensive surgery, but it is also safe. In present era, most discectomy patients get discharged within a day or two. Even spinal fixation, what I showed, nowadays can be discharged in about 5 days. There's no need of bed rest in most cases. So do not worry if somebody tells you need spinal surgery. In health, ignorance is not bliss, it is dangerous. Knowledge is power and comfort. So be armed. Do not hesitate to seek reliable medical help early if you have back pain. Thank you very much.